Welcome back to the Eye Health DocuClass. I'm your host, Jonathan Landsman. Today's focus is on one of the most critical parts of your vision, the retina. If you've ever wondered how to protect your retina or even improve its function, you're in the right place. Our first expert is Dr. Shalesh Kaushal, a board-certified ophthalmologist and a leading authority on retinal disease. In this eye-opening presentation, Dr. Kaushal reveals how your retina can offer early warning signs of chronic disease. You'll discover the most common retinal conditions, what triggers them, and how they're deeply connected to major health issues like dementia and diabetes. More importantly, you'll discover real natural strategies to support your retinal health before problems begin. Enjoy this presentation with Dr. Kaushal. Dr. Kaushal, I am super excited to talk to you about the retina. You are our top expert for this program talking about this topic, and it's been a long time coming. We've been planning this, right?
Oh, yes, we have. We've been talking about it for quite a while.
We have. So, like I said, I'm really excited. We're going to get a lot of great information. Anybody concerned about their retina, I want you to just get rid of all distractions and listen carefully to what we're about to talk about. At the beginning, I think, Dr. Kaushal, it's probably really good to start off with what exactly is the retina? No doubt lots of people think it's important, but let's get a better understanding.
Think of the eye like a camera. And just like in a camera, you have a lens, which is the cornea and our own native lens. And then the film of the eye, or film in the camera, the equivalent of that in the eye is the retina. It's the photographic film of the eye. It's a little thinner than tissue paper attached to the inner wall of the eye. And all the purpose of the retina, it has 9 layers, amazingly. But the real purpose of the retina is to absorb light, create an electrical signal. That electrical signal is processed appropriately, and then it leaves the eye through the optic nerve, which is the cable that goes to the back of the head. We all see from the back of our head.
It's really amazing when I think about how much we know, but perhaps I dare say how much we don't know.
Yes.
About, and you see, you're already agreeing with me, what we don't know about how exactly we see and its profound impact on everything, our consciousness, our mental and emotional well-being,
Absolutely.
Our behaviors. It just goes on and on. Tell me why you feel like the retina is a good marker for health and nutrition overall.
Yes, this is such an important topic. In fact, I've been honored and blessed to give talks about this particular subject, both here in the U.S. and internationally. So it turns out the retina has the largest blood supply per unit weight in the entire body. That blood supply is right under the white part of the eye, the sclera. It's called a choroid, that blood supply. There's other blood. Actually, the retina has 3 different blood supplies, but that's the largest. And secondly, the retina is the most metabolically active tissue in the entire body per unit weight. So you can imagine anything that's happening in the body, the retina is a very sensitive barometer of overall health and nutrition. And in fact, nearly every human disease you can think of has a retinal manifestation and or ocular manifestation in other parts of the eye as well.
It's incredible. A couple things come to my mind already, which I'm sure people will appreciate and really take more seriously. Blood circulation and metabolic syndrome.
Yes.
Those things I was thinking about. How
Yes.
often people have such poor circulation through their whole body, and millions of people are suffering with metabolic syndrome. And in many cases, they're not even addressing this. No wonder there's a lot of problems with the eye, no?
Yeah, absolutely correct. It turns out this is some wonderful work done by colleagues at Berkeley years ago. What they were looking at specifically was the amount of oxygen that is actually interacting with the visual cells. The visual cells are called photoreceptors. There are 2 major types. There's the rod cells, which are important for peripheral and night vision. And in the macula, our area of dead center good vision, are the cone cells predominantly. And those are important for, obviously, color vision and for central vision. But when they measured the oxygen content in the photoreceptors, if you move the length of the photoreceptor, because it's so metabolically active and it's extracting oxygen, the inner part of the photoreceptor, which is furthest away from that blood supply that we talked about, the choroid, it's very low oxygen content. So you might imagine any disease that affects blood flow could have a very significant effect on the performance and the fidelity and function of those photoreceptor cells as well as other cells in the retina. And that turns out to be absolutely correct, Jonathan, that blood flow is incredibly important for the eye as it is for any tissue.
Makes a lot of sense to me. Let's talk about the most common diseases now as it relates to the retina, please.
Yeah, sure. I think almost everyone has heard of macular degeneration, diabetic retinopathy. Those are the two important ones. I shouldn't say important. Those are very common ones that we see worldwide now, not just in the United States. In part because the aged population will talk about nutrition at the appropriate time as well. Many of these diseases, in fact, all my patients, I talk to them after the exam. It's such an honor and blessing to take care of people, but I educate them specifically about nutritional control of their overall health and, of course, their ocular health, which goes along with that, and in particular, their retinal health. So those are the two common ones, again, macular degeneration and diabetic retinopathy. There's others as well. Glaucoma, we're starting to appreciate as well as being a type of vascular disorder. Now, I'm giving a simplified version. There's a nuance to all of these as well. But you can think of those as vascular diseases of the eye, and there's been a greater attention to understand how we can measure, for example, blood flow to the eye, perfusion to the eye. In other words, how well the eye is receiving and the retina are receiving blood and extracting oxygen for their metabolic activity. And of course, when you're having such a metabolically active tissue, blood flow is important to remove those metabolic byproducts, which are otherwise, if they accumulate long-term, can be toxic to the retina.
Detoxification, good physical activity during the day. A lot of things seem to be coming to my mind in terms of being more important. As I've created this program and talking to experts like yourself, I have gotten, no kidding at all, such a profound appreciation for all the things that we hear about to be healthy. If we want to keep our eyes healthy and strong all the years of our life, a lot of these things are really so truly important to have in our life. If we get to the nutrition, as you say, let's talk about these triggers now, because if we understand what's causing these chronic diseases, it's very simple to think, you know what? Let's do the opposite. So please talk about the triggers,
Sure. This is one of my pet peeves, and Jonathan, I'm happy to talk about it. We could talk about it for hours. I've actually given lectures here in the U.S. and elsewhere for up to 4 to 6 hours about this subject. But let me just summarize it for everybody who's listening. In chronic diseases, here's some characteristics of chronic diseases. First, they're slow in onset. They typically occur later in life. We know there's a significant nutritional component to that. We're going to come back to that, as Jonathan was mentioning. And they have variable presentation clinically. In other words, macular degeneration, glaucoma, diabetic retinopathy, Alzheimer's disease for that matter, right? Age-related muscle loss. They have different manifestations in each person because we're all biochemically different. How different? We know that at least 8,000 different, what we call changes in the DNA, instead of using the technical jargon, we have 8,000 differences between each one of us, right? So you can imagine that translates to significant difference in our biochemistry. However, what's really quite remarkable is Mother Nature, when there's a stressor, right? There can be an intrinsic stressor to a tissue or a cell, in this case, the retina, right? The intrinsic stressors are what? What that genetic makeup is. What's the biochemical makeup of the cell? That's on one side. And then on the other side, what's the other stressor? The external stressors, what we consume, the air, the water, the food, right? How we de-stress ourselves, as it were. These are all they have very profound impact on every tissue in the body, and particularly the retina and chronic diseases. With speaking specifically about stressors. So here's the way I like to explain it to the audience and to people who are listening, is that think of the cell as having a set of springs that are connected to each other, right? And so if you jigger one spring, all the other springs vibrate. That's the interconnection of these various metabolic pathways that control the balance, or the physiological term for that is homeostasis, right? So again, if you jigger one spring, all the other springs vibrate. That's also the intrinsic intelligence of a cell. In other words, when it's faced with an internal or external stressor, those pathways vibrate, or they move in certain directions, or certain biochemical processes occur more rapidly or less rapidly so that the cell can adjust and come back to equilibrium, right? So a stressor is anything that can cause that to be out of equilibrium. What are the common ones we see in chronic diseases and chronic retinal diseases, right? They're remarkably similar. And what that tells us about Mother Nature remarkably is that there are about 10 to 12 conserved cellular pathways from bacteria to human cells that allow us to deal with stressors. So what are they? I'm going to list the most common ones. There's more, but let's hit some of the big ones. Inflammation. Now, what kind of inflammation? This is chronic inflammation. This isn't the inflammation that when we get a cut and it's painful, it's red, it oozes and so on. This is low-grade inflammation over our lifetime. Second, oxidative stress. Inflammation and oxidative stress often go together, right? Now, I'm sure you've heard from others, and it's almost a buzzword, is we hear about energy imbalance or mitochondrial dysfunction. Well, it turns out, you can imagine, if a tissue is as metabolically active as the retina is, even slight changes in how those energy factories called the mitochondria produce energy and or process various metabolites or nutrients can have a profound impact on the performance or how well that cell works. So those are three very common ones. There's often immune dysregulation, right? Some type of immune imbalance. And I'm sure, Jonathan, you've covered about gluten sensitivity. Well, it turns out there's now a whole series of published papers showing that gluten sensitivity, not celiac disease, but gluten sensitivity has a significant effect on the retina and the brain for that matter, right? To remind people who are listening, the retina is actually part of the brain. During embryogenesis or development, right, the retina is actually a direct outgrowth of the brain. So it's in fact, some of the earliest changes we see with mild cognitive impairment / Alzheimer's disease is in the retina. We can now non-invasively, there's many groups who've been working on this and publishing it, non-invasively assess whether they may be a chance of developing cognitive impairment or Alzheimer's disease. Okay, so immune disbalance, right? And then finally, the big one, Jonathan, you referred to metabolic syndrome. Yes, it turns out glucose dysregulation, right? Now, that's a big word, but what it means is how well the body can dispose of a bolus of our amount of glucose that it's presented with. And we hear about type 1 and type 2 diabetes. Type 2 diabetes, which is insulin resistance, leads to a significant glucose dysregulation. And it turns out in the retina, that's important as well. So those 5 characteristics, the triggers that I just talked about, those are central to retinal diseases as it turns out to be other chronic diseases. In fact, at meetings where I've given talks, I've sometimes been juxtaposed to some colleagues who are experts in Alzheimer's disease, and we chuckle after the meeting. We could have given each other's talks, just replaced the words and a little bit of the slides. But the fundamental principle that I would like to leave with everybody is these chronic disorders share common triggers. So improving the metabolic health of our bodies improves the functioning of every tissue in the body, including the retina.
I just shake my head as you're speaking because, and I'm sure you do as well, you were conventionally trained, you're a medical doctor. I'm sure you know where I'm going with this.
Yes, I do.
My audience appreciates the fact that there are great strides in Western medicine and amazing advances, I know for a fact that you're doing surgery so much, which is why it took so long for us to get together here.
Yeah.
You're doing some real life-saving procedures to help people live a quality of life. When
Yes.
you need it, you got to go to a Western, conventionally trained doctor and get some of these techniques done.
Yes.
But aside from that, all this other stuff is so well grounded in the medical literature. The research is clear, and yet we see this divide because there's clearly an agenda that's only being pushed, and it's very narrow-minded. My hope is that this program is going to really shake things up. We have a lot of healthcare providers that watch my programs, and they really start looking at things more holistically when someone suffers.
Yes.
I'd like you to address that for just a moment, if you don't.
Sure. That's another pet peeve of mine. Let me back up a moment and frame this because you touched on something very important. And that is what we're talking about, nutritional control of disease, does not exclude allopathic medicine, right? For example, as Jonathan was alluding to, part of the reason why we struggled, I should say struggled, but we've had some difficulties connecting is I had emergency retinal detachment surgeries to do over the last 2 weeks. And see, now that's a mechanical problem. So the retinal detachment, think of it as wallpaper coming off the wall. Now, no amount of metabolic improvement is going to fix that. Just like a broken bone, you actually have to go see an orthopedic person. And so in some sense, doctors like myself who do retinal surgery or cataract surgery, we're the equivalent of a contractor, right? So we know how to do plumbing, right? We know how to use a hammer and nail, our version of that. So we can fix these mechanical problems and get outstanding results because it's a mechanical problem, right? A cataract is a fuzzy lens or a cloudy lens. That lens can be removed and a new lens can be placed. Retinal detachment, likewise, is wallpaper coming off the wall. That's a mechanical problem. There are wonderful techniques now to put the wallpaper back on the wall, the retina reattach it, and we use laser as our version of contact cement. So that's on one side. Now, what Jonathan's referring to, and the way I frame it for my patients is this. Think of it like you have a fire. Now, you have two things you want to do, right? First, you want to get the fire under control as quickly as possible, and simultaneously, you would like to find where the source of that fire is, right? So let's say if it was a campfire that got out of control and it was windy and now you got a forest fire. Well, you got to get that forest fire contained. That's where the strength of modern allopathic medicine is. It's treating a symptom, an important symptom. In other words, the spread of that forest fire. But you got to treat the root cause of the problem, and that is putting out that campfire that triggered this larger forest fire. That's where nutritional/metabolic control are very, very important. So in my way of thinking, and I shouldn't say just mine, many physicians are now rethinking this, their approach to medicine, is it's actually a balance. It's a thoughtful use of pharmaceutical agents, along with nutritional supplementation and or other ways to get metabolic control of the body. Because those two, work together in the context of chronic diseases to stabilize and even, remarkably, in a certain set of patients, reverse the disease altogether.
And years before it's a serious problem, I hope people hear this message loud and clear. Let's have fun with this. Let's understand what the eye is trying to tell us years ahead of time before it's a serious diagnosis, which is what I'm about to ask you.
Yes.
And we can really, like you say, make profound changes, preserve our eyes, and enjoy what they can provide for us as the years of our life. So we're going to get into the nutritional plan, your best strategies, in a moment. But first, please talk about this link that you've been referring to between, diabetes and dementia and even high blood pressure.
Yes.
So all this got to do with the retina. Help us out.
Yes, absolutely. So I want to share a couple things. So people are calling Alzheimer's disease type 3 diabetes. You may have heard this, and I suspect some who are listening today are familiar with that. So I've proposed that macular degeneration is type 4 diabetes. Not that we need a laundry list of the different types of diabetes, but to emphasize how important glucose regulation is in the body, right? It's extremely important for cardiovascular health, right? Brain health, ocular health, muscle health. The list goes on and on. This concept, which was originally a concept, and now there's lots of wonderful published papers to support it, is this glucose dysregulation, right? In other words, the fluctuations in blood sugar, right? We don't want our blood sugars doing this. We want them to do this, right? That's really the goal, right? And what is the major contribution of that? And I'm sure, Jonathan, you've talked about this, refined sugar. Refined sugar is so easily assimilated across the gut, and you get these huge spikes in blood sugar, right? And as a consequence, insulin rises to drive that blood sugar into cells. Where does it go predominantly? It goes predominantly into our large muscles, right? Our quadriceps and so on. So just as an aside, and I'm in some sense preempting myself, I tell my patients, even if they don't have diabetes and they have evidence of macular degeneration or mild diabetic retinopathy or even changes from glaucoma, right? A simple thing like a 20-minute walk after dinner has a profound effect on blood sugar. It's really that simple. Now, it's not a prescription, right? We're not giving a drug to somebody. It requires some self-discipline and the desire to. Part of the thing that I see as a physician is to help reinforce these types of behaviors, not only in myself, because it's a challenge. I can tell patients, for example, and I tell them when I say to them, I said, it's easy for me to say, for example, get rid of processed food, getting rid of white sugar, white bread, and so on. White rice for that matter. It's easy to just say those words, but I think the important part for a physician is to reinforce that behavior, not only in live by example, right? And also I repeat it. Now, every visit, I will tell patients that I'm particularly concerned about, and even those that I'm not so concerned about. So, and they have it memorized. By the time I start my list, we actually give them a handout in clinic. And I said, look, I'm going to hit the highlights, but I want you to seriously consider all those items on that list. But this relationship between blood sugar and the development of chronic diseases has been fortified and I would say well established. And that's why this fluctuation in blood sugar, all of us, we want to limit that, even if you're not diabetic.
Even when it comes to blood pressure, I know that I've even experienced in the past. I know it can't be good. It's only been briefly.
Yes.
But you want to be careful if you notice in your eyes that sensation of pressure.
Yes.
Like the blood is beating.
Yes.
I can only imagine when someone doesn't notice that, and it goes on far longer than just a few seconds. For me, maybe a handful of times in the last 20 years, right? Something very small where I might be tired and rushing around and I notice that.
Yes.
But for someone else with high blood pressure, always up and down, just erratically getting these numbers high and down and up and down, the stress of that, just like sugar going up and down, can't be a good thing for, keeping the eyes stress-free.
Yes, Jonathan, that's a good point. That's the second part that let's talk about that right now. High blood pressure itself is an indicator of vascular dysfunction, right? I'm sure the listeners, and Jonathan, you probably covered the topic of endothelial dysfunction, and those are the lining cells of our blood vessels, and they're very sensitive to not only flow, eddy currents, buildup of potentially cholesterol. That's another interesting separate topic, and its involvement in retinal diseases. So high blood pressure itself is an indicator of some type of vascular endothelial dysfunction and or inflammation as well. And those cells are very sensitive to any types of perturbations in the metabolism of our bodies and in the way the blood is flowing through those blood vessels. Now, I'm summarizing brilliant people's work in 2-3 sentences or short paragraph, right? And of course, there's nuances to all this, but this is just to convey this idea to the listeners. Now, so high blood pressure itself can cause, there's something called hypertensive retinopathy, right? Where there's abnormalities in the blood vessels in the retina that we can observe. And those typically are what are seen elsewhere in the body. So as I mentioned earlier, the retina is a very sensitive barometer of overall health and nutrition. So that's on one side. So hypertensive retinopathy, an intrinsic disease, a disease of the intrinsic blood vessels within the retina. Then you have the other set of disorders, which high blood pressure is a risk factor for those diseases, including the development of diabetic retinopathy, right? Including macular degeneration, including glaucoma, and also various strokes of the eye, right? You can have vascular occlusions. A stroke is basically a blockage of a blood vessel. You can think of a heart attack as a type of stroke, right? The blood vessels of the heart are blocked for a period of time. So blood pressure and blood sugar are important physiological markers that are very modifiable. And I'm sure, Jonathan, you've talked about this. I know I'm repeating myself to some degree. But the point, though, is that these are modifiable, fairly readily changed to a more normal metabolic balance, which is what we're trying to achieve for everyone. Right?
And, another thing that's on my mind that, of course, I wonder about and will never know the answer. My father, I'm sure you don't know, had dementia, and at the end of his life, didn't know anybody in his family. I mean, a terrible, terrible disease. It's a terrible way to go. It is a lot to do. It has a lot to do with why I do what I do every day. It's just to think of myself as wanting to stay healthy all the years of my life, because the strain on the rest of the family is just enormous. And, I pray to God that it's not going to happen for me to put that kind of strain on my family. Having said that, years and years before anything catastrophic happens, if we had the right eye doctor just looking at the eye and seeing if there were signs of dementia years before something bad happens, is that at all possible?
Yes. There's wonderful clinician scientists throughout the country and elsewhere in the world. That, as you know, science sort of, it's being a clinician scientist myself, right? So science moves forward 4 or 5 steps up a ladder, and then comes down 2 rungs, and then moves up 5 and comes down 3, but we're moving forward. But what I'm getting at is this, there is now rising evidence, clear evidence, that we can find changes or discover or assess changes in the retina with clinical testing that we do as retina specialists that can help us identify precursors, mild cognitive impairment or Alzheimer's disease or other types of dementia as well. And so that's very exciting, because these are tests that can be done and interpreted by a skilled retina specialist.
What are those tests, though, so we don't leave people hanging?
Yeah. Oh, I'm sorry. Yes, of course. It's called OCT imaging. This is a way to image the structure, those 9 layers that I'd mentioned of the retina, and something called OCTA. OCT stands for optical coherence tomography. So there's standard optical coherence tomography and a newer technique called optical coherence tomography angiography. The angio means blood vessel, and it's actually to look at the blood vessels in that area of dead center good vision. And there are changes that can be now ascribed and understood in both the OCT and then separately in OCTA that can identify those types of patients. So it's now possible to have a prognostic tool rather than just simply a diagnostic tool to predict whether someone may be down the line susceptible to cognitive impairment / Alzheimer's disease.
Just a couple really quick questions for those who are wondering, though, as well. Is there radiation involved in this? People are going to wonder that. And number 2,
Yes.
What about the practicality of, I want to know if I might be showing early signs of dementia so I can be more proactive. If I go into the office and ask for it, is that a bit odd if there's no medical justification for it? Walk us through that. But first of all, is there radiation?
Yeah, that's an excellent questions, Jonathan. There is no radiation involved. And it's basically you're sitting in front of this specialized instrument. And of course, it requires you to be steady. If someone who has a head tremor, that's a little more challenging, but there's ways we can stabilize the head and, of course, the eye as a consequence. So the no radiation involved whatsoever. The second question is even a more intriguing question is, can you ask for this? Well, the answer is, of course you can. It's our bodies, right? Now, the real question underneath that question is your retina specialist that you're seeing, are they familiar with those tests and that research? The research is fairly new over the last, I would say, 5 to 7 years. I would say most retina specialists are familiar with it, but they may not understand the interpretation of those tests completely just yet. Or if they're motivated, they can learn it. It's obviously retina specialists are bright, talented people. But it would preferably you want to go to someone who's familiar with the techniques and the interpretation of those results.
Makes a lot of sense. Before we get to the nutrition plan, that's what I'm really excited about doing with you next.
Yes.
I just want to ask another very quick question. Obviously, processed food, fast food, junky chocolate cake, everybody watching my programs, they get it. This can't be good for the body, can't be good for the eyes.
Yes.
Something I always like to mention, especially if someone is new to this information, they're tuned in on wanting to protect their eye health. They go to the organic health food store, they exercise, meditate, they do all of these things.
Yes.
But a warning, I want to hear if this is something that concerns you, is that so many organic foods, especially the quote-unquote convenience foods in the deli, are littered with sunflower oil, canola oil. Oh, it's organic. Don't worry about it. Not that they say that to everybody walking in. Yeah. But what do you think about, because I know family members that swear by when they, oh my goodness, I wish I knew after they ate it, they discover there were oils in the mayonnaise or in the salads that they had. And this oil's making me, I can't see as well. Are they crazy? Is it all in their mind, or is it true?
Well, so, Jonathan, that's another broad topic, but an important one as well. Yeah, these processed foods and these processed oils, they're profoundly inflammatory. I suspect your audience, again, or at least a set of them, are aware of that. And obviously, you're alluding to that very fact. Yeah, so I talk to patients about, for example, using virgin olive oil, right? Cold pressed, for example, preferably from one particular orchard where the family's been harvesting those olives and been in the business for generations, right? Out in California, in Europe as well, and other places in the world. And I also talk to them about, for example, speaking of oils of types, right? Fish oil, right? Now, fish oil is, there's always some concern about that, where the fish are being harvested and heavy metal contamination and so on. I also talked to them about cod liver oil, preempting myself a little bit, but cod liver oil turns out to be very, very good for the eyes, and we will talk, and the retina in particular. And some people come and talk to me about krill oil. Krill oil is also very good, high quality krill oil. It's loaded with astaxanthin. Astaxanthin has been shown in many studies to protect the retina. A fun fact of sorts, something that your listeners can impress their friends at their next cocktail party. It turns out the largest concentration of omega-3 fatty acids per unit weight is the retina. The largest concentration of cholesterol per unit weight is also the retina. Now, cholesterol is often considered deemed as a villain, but cholesterol also has important biological functions in our body. And that's, for a separate day. And perhaps, Jonathan, you've covered that with other folks that you've interviewed.
Just to jump in, the cardiovascular docu class, one of my programs, we really expose so many things about cholesterol that most people never hear. But go ahead.
Yeah. So, coming back to just to summarize what you were asking about, yeah, these processed oils are just not good. They profound increase in inflammation. Like, for example, my patients will tell me, well, geez, Dr. Kaushal, you've told us about eating rainbow diet, as it were. So we buy canned vegetables or canned fruit. I said, okay, here's the thing. So, the oils, if you investigate that, the oils they use, it's often soy oil, right? Now, tofu itself is not bad for you, but the oil is profoundly inflammatory. I said, if you're going to buy it fresh is the best circumstance, okay? But if you're going to have a second option, frozen is not bad. Not frozen that's been fried and then frozen, but actual frozen vegetables, right? Even frozen blueberries when they're off season. That's a good thing to do, right? But you can't beat fresh.
Without a doubt. So now let's dive into it. From all of your years of experience, what do we want people to focus on eating more, feeding the eyes and the whole rest of the body, something that's really good and takes great care of them?
Yes. Okay, let's start with that, the list. My patients call it the list. So first is a good multivitamin with the B complex. Why is that? Well, the B complex is 11 different vitamins, right? So it turns out the nutrient content of our food has declined rather precipitously over the last 40, 50 years. In other words, the broccoli we see today is not the same broccoli it was 50 years ago in terms of its nutrient content. And part of that reason is the way fertilizers are used. They're often depleted in magnesium, right, to make plants grow faster. Well, it turns out magnesium is important for approximately 300 to 400 biochemical reactions in our cells and in other cells, including plant cells. And they're critical in the production of various compounds in plants and, for that matter, us as well. That's why I recommend a good multivitamin with the B complex. Now, people will say, well, geez, that's been disproven in the published literature. That was true about 10, 12 years ago. We could talk about the details of those studies and how perhaps they weren't appropriately designed. But there have been more recent studies that clearly show, in the peer-reviewed medical literature, that taking a multivitamin with the B complex is incredibly important for our metabolic health, and it reduces the chance of getting chronic diseases like Alzheimer's. Okay, so that's number one. Number two, I alluded to it already, but it's worth mentioning again. Fish oil, omega-3 fatty acids. How much? I tell my patients at least 2,000 milligrams a day, right? And it should be a high-quality fish oil or krill oil, which we alluded to as well. But in my mind, the best probably is cod liver oil. So why is that? So the liquid form has probably the highest concentration per unit weight that I'm aware of. Maybe there's some liquid fish oils, higher concentration, but liquid cod liver oil, highest concentration of omega-3 fatty acids per unit weight. It has a little bit of vitamin A and vitamin D, a modest amount, and many times there's some vitamin E as well, which is good for our bodies. And it also prevents the cod liver oil from being oxidized. That's that rancid smell that many of us remember when we were kids, right? And then finally, cod liver oil has a set of compounds called the retinoids. Well, years ago in my lab at UF, at the University of Florida, and then subsequently, we showed that the retinoids can actually improve retinal function. We even had a patent, and I don't know if I'm not too concerned about the patent. Maybe University of Florida is, but I'm not so concerned about it. But I tell patients that it can help them, especially with their night vision, right? And a lot of patients, for example, patients with macular degeneration, if you look at patients with macular degeneration, age-matched controls, in other words, without macular degeneration, the folks with macular degeneration have profoundly decreased retinal sensitivity to light. What does that mean? They need more light to see, both in the daytime and at night. So I tell them, take cod liver oil. It can help you a little bit with your night vision. And I've taken it myself. And all of these recommendations that I tell my patients, I said, we do it as ourselves, as a family, and anyone else in my extended family who is receptive to it, that they are also doing it. Third is lots of greens, kale, broccoli, spinach. Those three in particular, but the others too, right? Green beans, green peppers, asparagus, Swiss chard, and so on, collard greens. So why those first three? Because they're loaded with a compound called sulforaphane. One of my mentors when I was a medical student at Johns Hopkins, he discovered, Paul Talalay, that sulforaphane has a profound protective effect on the retina. So how do you want to cook these? You don't want to, make them soggy. Like broccoli, if you can eat it fresh, nothing like it. But if you do want it, you can slightly saute it, but it still should be crunchy, because otherwise the sulforaphane can't be appropriately absorbed by us. And then fourth is lots of dark vegetables, blueberries, blackberries, raspberries. These fruits, right, in particular, you don't want to eat a tremendous amount because we don't want that blood sugar to rise really high, right? But like a handful. Say you have it with your oatmeal, steel-cut oats in the morning, or if you have a handful during the day. In fact, that's often my wife and I will snack on blueberries during the day in clinic. In addition, I also talk to them about taking supplements. We'll come to that in a moment. But I also mentioned to them the importance of exercise. We talked about it a little bit. Even 20 to 30 minutes a day of walking after dinner, or any time for that matter, right? Doing squats. Squats are tremendous for driving down blood sugar. Nearly every day, I'll do at least 20 squats along with my other exercises first thing in the morning. That's to drive that blood sugar out of my system into the muscles, right? And then the other one that is often not spoken about so frequently is sleep. So why is sleep so important? It turns out patients that you can in medicine, we see a lot of this, right? Is people who are sleep deprived. If you look or do PET scanning, right, to look for changes that seem similar to Alzheimer's, people who are sleep deprived, their brains look like Alzheimer's patients, right? However, if they get more sleep, they clear the debris, right? There's these little cells in our brain, and Jonathan, I suspect you've covered this topic as well, that help clear the debris within the brain itself, and for that matter, the retina, right? And it is important to get in uninterrupted at least 6 to 8 hours of sleep, right? Preferably closer to 8, right? That's really important for the body, the metabolism for sure, and the functioning of the brain, the retina, and so on.
And it has a lot to do, interrelated, as you've been saying throughout this whole presentation, with our light exposure early in the morning, not so much artificial light at night so we can go to sleep. Our melatonin levels can go up.
Yes.
And the food that we eat, obviously alcohol, too much fruit, even organic wine, organic fruits, 10, 11 at night, it's going to be a little trickier to have that sustained restful sleep, which we really ought to be shooting for from 10 to 2, 3 in the morning at the very least, the most restorative hour.
Yes, absolutely correct, right? Jonathan, I want to come back to one thing. I mentioned the dark greens and sulforaphane. The other point that I want to make is that those carotenoids, those pigments in those dark green vegetables, right? They collect specifically in the macula. In fact, a wonderful colleague of mine discovered that there's receptors for those carotenoids, those pigments that make foods green or dark green. And why is that important? Well, carotenoids are wonderful natural antioxidants. And as we were talking about, the retina is a very metabolically active tissue. And indeed, the macula of the retina, of all the regions, so think of the retina like a big circle, and the macula is a smaller area within that circle. That's the most metabolically active part of our entire body. And so you can imagine, even for example, as you and I are looking at each other on the computer, right, is we're actually generating quite a bit of photooxidative byproducts in our macula. And these carotenoids protect it. And in fact, there are now instruments, non-invasive instruments that are easy to use in clinic. The previous ones used to be these bulky instruments where you can actually measure the carotenoids in the macula. And that's why it's important to consume lots of dark greens. Interestingly, patients with macular degeneration have lower levels of that pigment in the macula, those pigments, I shouldn't say pigment. And interestingly, so are patients with diabetes. And even more interestingly, this is more recent work that was published, is that patients with cognitive impairment have low levels of carotenoids in the macula. Now, I wouldn't want anyone to leave this presentation or this conversation thinking, well, geez, low carotenoids, that leads to cognitive impairment / Alzheimer's. No, those are correlates. So in other words, it's an indicator of a possibility of cognitive impairment. It's not going to cure the cognitive impairment, right? But in the instance of macular degeneration and diabetic retinopathy, those can actually slow down the disease by consuming those pigments, those carotenoids.
It's incredible. As I listen to you, it's been a common theme throughout this program is that we consume light energy in a sense and really places a significant value to the kind of foods we eat, like you've been saying throughout this whole presentation.
Yes.
Live, fresh, real foods that were raised by sunlight, getting out into the sunlight, not staring at the sun and hurting your eyes, obviously, not burning your skin, but just that kind of nutrition, feeding yourself live, healthy foods, dark greens that were exposed to the light, live, local foods, if you can get really fresh and eat that food on a regular basis and exposing yourself to the light. What a healthy thing to really do for our retina. Even if we had our eyes closed and the light is hitting our skin and going through, it has a profoundly positive effect, no?
Yes. Yeah, absolutely. So I agree with everything. You and I resonated even the first time we talked about this whole area. But, coming back to light for a moment. So D3, low D3 levels are associated with macular degeneration, right? And diabetic retinopathy. In fact, low D3 levels are associated with dry eyes, which is probably one of the most common eye disorders, even though we're not talking about it just now. But it shares the same pathogenesis as these other diseases, inflammation, oxidative stress. And so making sure, in our handout, I talk to patients about D3. And the published levels that most labs have, patients or their primary care doctors will say that, oh, geez, it's in a good range. And I tell them, no, you want to be on the high end of that range always, right? You want to have tropical levels of D3, like our friends who live in the tropics and, wear short T-shirts and shorts all day long. They're producing tremendous amounts of D3 in their body. But the rest of us, even those of us who are blessed to live in Florida, we don't make enough D3. And so it's important to supplement that and get that checked regularly. That's really, really important.
Final word with nutrition. I know people hear it all the time, but I hope they appreciate it even more. The foods that we're talking about, fresh, organic, fruits, vegetables, as close to a farm as you can get them close by, not so far away. Obviously, fresh is important. Yes, really hydrates us. And how many people you must see, right? God forbid anybody, but when you're talking about somebody in really bad shape with these serious eye diseases and not thinking much about this, how many of those people are dehydrated? Please speak to that for just a moment.
Yeah, the number one cause of ER visits in the state of Florida is what? Dehydrated elderly folks. I can tell you dehydration, forget about Florida, it's a big deal everywhere, right? We don't drink enough water, good quality water for that matter, right? That's incredibly important. 70% of our body is water, right? So we need, and water is critical for the performance or the functioning of our cells and tissues for sure. And in fact, I've seen patients, and so have many of my retina colleagues around the country, around the world. Dehydrated patients are at a much greater risk of developing a stroke of the retina. And sometimes those are irreversible events. Sometimes we can, if they come to see us soon enough as retina specialists, we can do things to help improve the functioning of the retina. So yes, Jonathan, absolutely right. Dehydration or hydration is incredibly important. And I'd say the cousin of that is electrolyte balance too, right? Because when we're out in the sun or even indoors for that matter, we are evaporating water, and of course, electrolytes follow the water. So it's important to make sure that we're also getting plenty of electrolytes too.
Just as we close out, Dr. Kaushal, so people aren't leaving this really panicked, I really want to put this on the ground for everybody. We talked about things to avoid the processed oils, obviously the junky stuff, living a healthier lifestyle. It really is a matter of being sure that we do that more often each and every day. Please talk about the importance of consistency, setting people's expectations up as to when they can see positive changes. But
Yes.
so even in terms of what they hear about blueberries or greens, our Western mindset might think, I just have to do a lot of this for lost time. But
Yes.
keep in mind, the blood sugar issue that you brought up before, a pint of blueberries is not better than maybe a quarter cup of blueberries and just maybe goji berries the next day, a handful. And please just speak into what I'm referring to about the great value of just being consistent, clean, and simple versus overdoing anything.
Yes, that's such an important point. And that's why, remember I mentioned earlier, I repeat it every time to my patients. And I even tell them, I preface it by saying, I never get tired of saying this. And then they will start repeating it because they've learned it. But this is a consistency, of course, in life. I learned from one of my mentors, another sidebar, 99% of being successful is showing up. Just showing up every day and giving it your honest 100%, right? So likewise with this, what I tell patients is, we give them this handout, and some of them may be partially familiar with it. Some are not familiar with it. We tell them, look, here's the thing. I don't want you to do all of these tomorrow and then a week later stop all of them or give up on them. This is a sequential addition. It's like building a Legos fort, right? You can build a nice tall one in 2 minutes, right? But we're building a fort, and it takes time. So you do one thing, do it every single day. Then when you're comfortable with that, I think some psychologists have shown, I think Nobel Prizes given for this as well. It takes about 21 days to develop a new habit. So you want to do it consistently, just as you were referring to, Jonathan. Then I tell them, look, when they come back, I said, geez, how's it going after I do the eye exam? And they'll say, this is working and this isn't working. I said, okay. Well, perhaps you can try this. I learned this from some of my other patients or my own experience. And the idea is to sequentially build up, not go like this and then come crashing down, but slowly build up the change. For example, in our family, we decided to go gluten-free. This was many years ago. We didn't do it overnight. It took a little while. And now it's just the fabric of the food we eat. It's gluten-free, right? Or it's not the fabric of our food, technically, right? But the idea is to do it slowly, steadily, and thoughtfully so that it becomes part of our, and I never use the word, by the way, diet. I don't like that word. None of us probably like that word because it implies it has a negative connotation, right? Because then if you come off a diet, right, then the negative things happen. This is changing the way I say to my patients is we're trying to optimize your metabolism. We want all of your cells functioning at whatever your intrinsic, natural best function is to work at that level. And the way we do that is slowly and sequentially by adding things, right? Now some things are simple to do, right? For example, eating more greens. For most of us, some people don't like greens, so I tell them, well, let's try other greens, and find some greens that you like. It may not be broccoli, kale, or spinach. It may be others. That's okay, right? It's a step in the right direction, and perhaps one day they may like broccoli, kale, or spinach, right? And so the idea is to build slowly and steadily. To come back to your point, Jonathan, so there's a consistent change that you no longer have to call a diet, right? It's just the way you live. You've decided to live in a better place, both psychologically, spiritually, emotionally, and of course, metabolically.
It's a great message, Dr. Kaushal. That's what the theme is throughout this entire program. Pun intended, we really need to appreciate the importance of having a vision for exactly the kind of life we want. I want better eyes. I am improving my eyesight every day, really feeling that in mind, body, and spirit, and just do those things. I've never dialed in my lifestyle as well as I have right now, and I've been working on this for nearly 40 years, and I continue to work on it, just as you described. So we're all in the same boat. Dr. Kaushal, I know you're extremely busy, traveling around, doing lots of surgeries, helping as many people as you can. I cannot thank you enough for your generous amount of time that you have given to us today. Thank you very much.
Jonathan, it's my honor and blessing that you invited me, and I'm delighted to have the opportunity to share, hopefully, meaningful things for the listeners.
Next up is Dr. Brian Mowll and an exciting presentation that everyone needs to hear. Dr. Mowll will explain how blood sugar imbalances, often overlooked by conventional eye doctors, can quietly put your vision at serious risk. If you're dealing with insulin resistance, prediabetes, or even mild blood sugar swings, this presentation is for you. You'll find out which nutrients best support healthy vision, the hidden dangers of high blood sugar, and what you can do today to protect your eyes and your overall well-being. Enjoy this presentation with Dr. Mowll. Dr. Mowll, thank you very much for being with us. Blood sugar is an extremely important topic when it comes to eye health, right?
Yes. Yeah. In fact, it's probably one of the most important things. There are several metabolic implications, I guess you could say, when it comes to eye health, but blood sugar is a big one.
Yeah. So let's focus in, because I really want people to take this so much more seriously. I say it in that context because when I turn on the TV, you see so many of these blood sugar ads and people are smiling and it's no big deal. They're 160, 180, and they just take this drug is the idea of the commercial. And now they're like stable, they call it. And I'm sure you shake your head at it because the numbers I see are still like 116 or about 120. They'll show that on TV as if that's somehow a good number. And it's crazy because I don't think enough people are really taking this serious about blood sugar. So please explain, how does high blood sugar hurt our eye health?
Yeah, and I'd love to go even a little deeper than that, if it's okay, Jonathan, because the blood sugar is really just sort of a sign. It's sort of what you can measure to get a sense that there is a problem, but there is so much underneath the surface, right? So, the old iceberg analogy where you see the tip of the iceberg, but there's so much more under the water that is more dangerous. And with blood sugar, the high blood sugar in and of itself can be dangerous, and we'll certainly talk about that. But what causes the blood sugar to be high is even more dangerous. And for most people, for 95% of people with high blood sugar, that's something called insulin resistance. I know you've spoken a lot about that. We can look at things like fatty liver disease, which you did a whole program on, that can be related to that as well. But the insulin resistance and high blood insulin levels, insulin's a hormone, that leads to blood vessel problems, blood vessel damage, things like high blood pressure, oxidative stress, all terms that I'm sure your audience has heard quite a bit. These things damage the tiny little blood vessels in the eyes, lead to eye bleeds and vision problems, and eventually can even lead to blindness. In fact, one of the main causes of adult blindness is, in fact, high blood sugar, which can become diabetes eventually, but it doesn't even have to be diabetes. That's the point, is, like you said, you can have a blood sugar 115, 120, not be diabetic, but still have major problems developing in the eyes and throughout the body.
To me, I'm shaking my head, especially as I've been doing so many of these presentations for eye health, because I know for a fact that conventionally speaking, people are being touched by these optometrists, even perhaps going to see an ophthalmologist, and you can see what you described. The blood vessels, they're leaking, they're breaking down. This is not good for our circulation. Blood pressure is going up. Such an easy thing to check, even for somebody to do at home. But when they see it in the doctor's office, and yet the eye health problems and connecting that to what you just said, rarely, if ever, is even told to people. So many people walking around, they have no idea, right?
Absolutely. And the eyes are interesting because they really are a window into the vascular system. So, you can have an optometrist or ophthalmologist look in your eyes, and it can tell you so much about the state of health in your vascular system, your blood vessels, whether there's inflammation there, whether there's damage to those blood vessels. And that can tell you a lot about how the vessels around your heart are doing, for example, or to your other organs. So when your blood sugar is high, or when you have insulin resistance, or your blood pressure is high, you have what we call metabolic dysfunction. That will not only damage the blood vessels in your eyes, but damage the blood vessels in your kidneys and cause kidney disease. The blood vessels going to your sexual organs, leading to sexual dysfunction, the blood vessels going to your brain, leading to things like dementia and brain disease. The eyes are one way to look at this, and of course we want to protect our eyes and keep our vision and make sure we have good eye health. That's what this is all about. But they're also sort of a surrogate marker there for the rest of your body and your vascular health, so really important to look at.
Yeah, and I hope people see how we're bringing this all together. We're going to get into foods and nutrients soon. We're going to next talk about how we exactly test this for insulin resistance and metabolic imbalances. That's the next thing we want to talk about. But please keep in mind, for all those listening to this message, eye pressure, poor circulation, headaches, eye pain, really connect this to my circulatory system and how is my blood sugar, my blood pressure, and insulin resistance, which you've been talking about now for a little bit. How do we test insulin resistance and these metabolic imbalances that are going on? What do you tell people?
It's a great question. So most people have had their blood sugar tested, and that's part of what's called a basic or sometimes a comprehensive metabolic panel. It's often done as part of a routine blood workup by your primary care physician or functional medicine practitioner. That's a good starting place. It is important to have good blood sugar, but we can't stop there. Just like with lipids, and other, kidney and liver markers, we've got to go a little bit deeper to get a better understanding.
Can I jump in for just a moment?
Sure.
I realized I was talking about the TV commercials, but here it is. We have a blood sugar expert with you. Can you just really set the record straight in terms of where our blood sugar numbers should be? Fasting, normally, what is normal even when we eat, say, quarter cup, half a cup of blueberries? How naturally to go up, but how quickly should it go down? Really give us a good overview of what is healthy so that we know what our baseline is.
Yeah, absolutely. So normal fasting blood sugar, so we call it baseline blood sugar. That's before you eat and when you've been fasting for at least 4 or 5 hours. So your body is in what's called a fasted state. Should be around 80 to 85 milligrams per deciliter. That's the test that most people get. So right around 80 is considered optimal. There is a range there. So if it's in the high 80s or even low 90s, it's probably fine. There's going to be some fluctuation. But once it gets over 100 for sure, fasting, that's called dysglycemia or elevated blood sugar in this case. Doctors will call that pre-diabetes. I don't like that term. To me, we don't want to have pre-cancer or pre-heart disease or pre-diabetes or pre-anything. We want to be healthy, right? So let's not look at that as if it's okay. If the blood sugar is elevated, that's a problem. There's also a test called, I'll finish on the blood sugar test. When it reaches 126 milligrams per deciliter or higher, that's diagnosed as type 2 diabetes or type 1 diabetes as well, depending on the history and so forth. And that marker seems a bit arbitrary, but it's just based on some research and normative data and so forth. So the 126 number is when it's diagnosed as diabetes. When you eat food, your blood sugar should go up a bit, and it depends what you eat. Obviously, if you're eating just some protein, like a couple of eggs, it's not going to go up much. If you eat, like you said, a bowl of blueberries or strawberries or something, it's going to go up a little more, but really it should go up about 30 points, or I should say no more than about 30 points or so, 30 milligrams per deciliter. If you get a huge jump, like your blood sugar is going up 60, 70, 80 milligrams per deciliter, that's a sign, again, of dysglycemia or an imbalance in your blood sugar. You're not able to regulate and control your blood sugar very well.
Isn't it true, just for people to not freak out, but take this as great information that you're giving people? Wow, blueberries don't really agree with me, right? Like I check it and I see, I eat, maybe my baseline is 100, 105 or 95, and whoa, I went to 145, 150. I don't like that. But isn't it true that maybe I'm down here in Florida? So just as an example on my mind, I have some watermelon. Wow, that went up like 22 or 25 points, right? Not a big deal. So it's not necessarily all fruit or all foods. It just really depends on what would agree with you or not. Is that fair to say?
Absolutely. And also the time of day that you're eating it, what you did before you ate it. So, did you have a poor night of sleep the night before and you're eating it first thing in the morning? Or did you go for a nice walk or have some exercise and then had the fruit? You will see a totally different response. But you're right. And also the amount. So you might be able to have a quarter cup of blueberries, where if you sit down and eat a whole pint, that might raise your blood sugar too high. So yeah, all of this information is really helpful, and no two people are the same. So you might do fine with blueberries where someone else might have a spike. And so that's something that is important to look at for sure.
And then also, of course, something that really, again, highlights the importance for people with blood sugar issues. I would imagine you would think that after you're eating, just a little mild, we're not talking about jumping up and down and being an Olympic athlete, but walking or moving rather than just sort of sitting still, it's a very overall healthy thing to do when it comes to regulating or keeping the blood sugar from hanging and spiking so high all the time. Isn't that fair to say? On top of eating really well to keep you more stable. It's just a great habit to have, right?
Absolutely. I mean, the more energy you can burn from your muscles store energy. And when you exercise, they burn that energy. And one of the forms of that energy is glucose. It's stored as glycogen. So when you exercise, you burn that energy. And when you burn that energy, it creates kind of a vacuum to suck up more of that glucose out of the bloodstream. Also, when you exercise, the muscles contract. And again, this could just be a walk after a meal. The muscles contract, and that will stimulate the uptake or intake of glucose out of the bloodstream just from the muscles contracting. So, yeah, I mean, exercise, post-meal exercise is one of the best ways to lower your blood sugar or reduce the impact that a particular meal might have on your blood sugar.
I appreciate you taking this road with me and explaining things for everybody out there. Now let's get back to this whole thing that you say is a deeper issue to focus on.
Right.
Insulin resistance, the metabolic imbalances you mentioned. How exactly do we go about testing to see where somebody's at, what's normal, what's not? Talk to us about that.
And I will mention one other test that a lot of people have heard of that is kind of a blood sugar test, and that's called hemoglobin A1C. A lot of people have either heard of it, you've talked about it, or their doctor may have ordered it. It's not a direct glucose test, but it's a test that's measuring how much sugar is basically stuck to the red blood cell, per a certain part of the red blood cell. And the higher that number is, the higher your blood sugar likely is. So it's kind of an average. So it's a good way to sort of look at your blood sugar control over a 3 to 4 month period of time, which is how long the red blood cells live. And so that should be right around 5% or so. And if it gets up to 6 or 7 or 8, that's a sign that your blood sugar is high and has been high continuously for quite a while. So important to look at. The deeper issue, I believe, and this is going to touch a lot of people listening to this, because there's a lot more people with metabolic dysfunction than there are with diabetes. You know, diabetes does affect a lot of people, but it's a small percentage of the population. Metabolic dysfunction, insulin resistance impacts well over half the population. So this is a huge problem. And the other issue is most doctors do zero testing for insulin resistance. They'll look at the blood sugar, like we've talked about. If it looks normal or just slightly high, like maybe it is over 100, but it's not, into the diabetic range yet, they generally don't do anything about it. So they'll just say, okay, your blood sugar's a little high, let's watch it. That's not okay, because most of the time there are other factors driving that, causing that. And that's what we're talking about here with the insulin resistance. So how do you test for that? Well, there's a hormone test, which I mentioned, called insulin. So the hormone insulin controls and regulates blood sugar. You can directly measure insulin in the blood. It's very simple. Any lab can do it. And then you can look at that next to blood sugar, next to the glucose test, and create something called a HOMA-IR score. And if you just go to Google and type in HOMA-IR calculator, it's HOMA-IR, you can put in your glucose level and your insulin level, and it'll give you a score based on those two readings. And that will tell you generally how insulin resistant you are based on those two numbers. So a normal HOMA-IR is 1.0. That's the standard sort of perfect HOMA-IR. If it gets higher than that, certainly if it gets above 2 or 3 or 4 or 5, I've seen very high numbers, that's a sign that you're insulin resistant. Now, there's other markers, but that's a really good place to start, HOMA-IR. So get your insulin tested, get your glucose tested. Your doctor has probably heard of HOMA-IR. It's used a lot in research studies, but your doctor's not going to be able to give you the number. You just have to go to Google, type that in. You just put those two numbers in, and one of those online calculators will tell you what your HOMA-IR score is.
People are not testing this normally.
No.
We just cover a little bit of finances here. Is it something out of pocket people have to pay for? Generally speaking, can anyone get it with insurance, or does it have to be medically justified to do this? All those little things. Can you kind of help us understand that?
It's not an expensive test, and most insurances will pay for it, especially if there's some indication for it at all. So if you have high LDL cholesterol, for example, or you have high blood sugar, like not diabetic blood sugar, but if it's just elevated, if you have a family history of diabetes or even heart disease for that matter. So there's a lot of indications for this. The harder part than getting insurance to pay for it, if you have insurance, is getting your doctor to order it for you, because many doctors don't see the value. There's no drug to treat it or reduce it. It's not part of the standard blood workup yet. It should be, but it's not. So many doctors aren't doing it. Now, most functional medicine doctors, naturopaths will order it without any problem, but your conventional physicians may not. It's easy to get on your own through direct labs or life extension labs, or there's dozens of these lab facilitating companies now, and it's probably a $20 test. It's very inexpensive, so you can certainly get it done on your own.
No, I'm glad you covered it, because this, I think, is at the heart of the matter when people kind of get frustrated. Why isn't my doctor telling me, like you just outlined very clearly? Is this not part of their SOP, standard operating procedures? So stop expecting it. Get a good physician like yourself, somebody, coach, anybody who can work with you to understand numbers, figure out where you can get these tests done, and just get them done on your own. Let's talk about symptoms, right? Diabetic eye problems. What exactly does that look like? Help us to understand this.
Yeah, so there's a name for eye problems related to diabetes, and they just call it diabetic eye disease. And there are a number of different conditions, diabetic retinopathy, for example, but also things like glaucoma and others can be related. Cataracts can be related to diabetes. The symptoms can vary based on what the problem is, but we're looking for, obviously, a change in vision. If your vision is getting worse quickly, if your color vision is changing or your night vision is changing, those are two signs of potential vision problems. The one that I really look for above all others is fluctuating vision. And especially if you can connect it to your blood sugar or blood pressure changing. So if you notice your field of vision seems cloudy or a little blurry or off, and you check your blood sugar and it's higher than, or your blood pressure is higher than what's normal for you, that's a pretty clear indication that you've got some sort of blood sugar or blood pressure, metabolic health related eye issue. That's one thing I always look for, is that fluctuating vision. If your vision is just gradually declining and it doesn't seem to change from day to day or hour to hour, and it's not related to anything that you can notice, it doesn't mean it's not related to your blood sugar, but it's probably more of a long-term issue that has many factors. So the main things I look for, obviously, blurred vision, changes in your nighttime vision, color vision, like the colors seem a little duller, or spots in your visual field. If you've got, dark spots, that could be a sign of retinal issues. And then that fluctuating vision is one to really look out for.
I really appreciate this information. I'm going to be very candid about something I was thinking about when you were talking. I personally wouldn't do it right now because I don't have any of those symptoms and feel fairly stable during the day, and my diet is really dialed in. I feel at this point that I wouldn't wear one of those patches, any of this wireless type stuff. But if you don't mind for a minute or two, I'm just thinking with a compassionate heart of all those people out there who have such serious eye problems. They hear this program, someone that loves them is pulling them over to listen to you right now, and it's just out of control. They really don't know. I'm thinking, you know what, even like I don't like x-rays, but I talk about getting a cone beam for the mouth to understand, do you have a hidden infection? Instead of just staying away from the x-ray your whole life and walking around with a hidden infection that could get really serious and cause you major problems, better to have that x-ray. I'm thinking this wireless type patch that you put on your arm for a short period of time to get this insight, coupling that with just checking your blood pressure at home. Just put the cup on, push the button, these digital machines, they're wonderful. What do you think about that, using it together for a short period of time and for how long to get a handle on things?
Yeah, I think it's a really good point. And that's exactly the way I recommend using those. They're called continuous glucose monitors, or CGMs. And generally, they're going to go for about 2 weeks. That's the most common sensor length, the length of the activity of the sensor. The sensor is the part that you put on the back of the arm. And it has a very fine needle. You really don't feel it, that sticks into your body. And it just takes a very tiny sample of fluid out of the back of your arm on a continuous basis. Again, unless you like bang it on something, you're not even going to know that it's there. A lot of people do wear them all the time, like for months at a time. You can do that. I'm not a huge fan unless you've got diabetes and you really need it for a medical reason. But I love the idea of wearing it for 2 weeks to look at and analyze your blood sugar patterns. We talked about this fluctuating vision. Maybe you don't carry a glucometer around with you, so, or maybe you don't even own one. So how do you check your blood sugar if you've got a little bit of a vision issue? The CGM solves that problem because it's always checking your glucose levels, and it records it on your phone or, in an app. So you can go back and look at the last 8 hours or look at the last 24 hours and say, okay, yesterday at, between noon and 2, I felt like my vision was a little off. Let me check to see where my blood sugar was during that time. Or we talked about different foods. I had a pint of blueberries or strawberries. What did that do to my blood sugar? I went out for a long walk. How did that impact my blood sugar? I had a fight with my boss, or I was, sitting in traffic and felt really aggravated. How did that impact my blood sugar, right? So all of these things can have an impact on blood sugar levels. And the more insulin resistant we are, the worse our metabolic health is, the bigger impact those things are going to have on our blood sugar. So it's good to have some data to go back and say, oh, look at what that stress did. Look at what that poor night of sleep did, or waking up at 3 o'clock in the morning did to my blood sugar, or look at what that pancake, even if I thought it was like a healthy almond flour pancake, look what that did to my blood sugar. So it's a really good tool to use, but you don't have to wear it forever. Wear it for 2 weeks, get some data, do some tests, take some good notes, and then maybe you don't wear it again for a month or 2 months or 3 months. And then, if you feel like you've made some improvements or you want to test it again, wear one for another 2 weeks. And I think that's a helpful tool. And there are, just real quick, there are changes happening to this technology constantly. And there are now 2 devices which you don't need a prescription for. In fact, they're made for people without diabetes. So you can't even get one if you have diabetes. They're made for people who just want to check their blood sugar. They're not covered. Those are not covered by insurance, but they're pretty inexpensive out of pocket for, if you're going to just wear one for 2-week period of time. It's like $50, I think. There are ones made by Dexcom, which is the one I prefer. That's called the Stelo. And there's one made by Abbott, which they have pretty good technology also. That's called the Lingo, but the Stelo seems to be better. So for anybody who wants one, I'm probably giving you too much information, but there's some good technology out there and some new devices that anyone can get.
I don't think you gave too much information. In fact, this is you and I share this same concept of the more feedback somebody can get, and they're conscious of it more, thinking about it more, until things are dialed in and you can sort of check it off your list. I think it's just so much better. So as we continue here, we're talking about people now that have high blood sugar. Let's focus on those people out there. What can they do to protect their eyes? I mean, obviously the answer, get the blood sugar down, okay, get it in order, but give us some more specifics about what they can do to really protect those eyes from damage.
Absolutely. And there's a lot that can be done. Don't wait until you have diabetes. If your blood sugar is quote unquote, a little bit high. It's in that 95 to 105 or 110 range. Or if your A1C, hemoglobin A1C, if you've had that tested and it's in the 5.5 to 6 range or just over 6, not diabetic yet, but it's a sign that your blood sugar is higher than it should be. Or maybe you go out and get that insulin test. And I didn't give the number, but a normal fasting insulin is around 5. So let's say it comes in at 10 or 12 or 13 or something like that. That's high. That indicates insulin resistance, and that HOMA-IR score that I mentioned earlier is going to be elevated. If you're in that situation, you definitely want to be focusing on improving your eye health, protecting your eye health, improving your vascular health, and protecting your circulation, because that's going to protect all of your organs. Remember, the eyes are sort of the window into our vascular system. So what can we do? You mentioned it. It's kind of obvious, but we definitely want to optimize our metabolic health. We want to get that blood sugar down. We want to become more insulin sensitive. Another factor is inflammation. So there's tests like C-reactive protein, fibrinogen, ferritin, homocysteine, other tests. I'm flying through them, but I know you've probably talked about these with your audience quite a bit. These inflammation markers can give us some insight into maybe even hidden inflammation, but that inflammation can damage blood vessels, so we want to get that down. And that can be done through eating a more anti-inflammatory diet. We'll get into some supplements and nutrients here in a few minutes, but doing some things to reduce inflammation can be helpful there as well. Protecting the eyes from damaging light, UV, wear sunglasses, especially like in the middle of the day. Not all the time. The eyes do need some sunlight, of course, but if you're going to be out all day long, wear something to protect the eyes. Screens, we want to protect the eyes. You can use blue light blockers. There's much more advanced technology out there now as well. And obviously just avoiding screens or taking some time away from screens. There's a common recommendation. It's the 20-20-20 recommendation. So if you're sitting down working at a screen for a long period of time, don't go more than 20 minutes. If you hit 20 minutes, I recommend going outside or at least walk around your office or your home. Look off into the distance, at least 20 feet away, so that your eyes, the eye muscles can practice focusing on something further away, and do that for at least 20 seconds. So that's the 20-20-20 rule. Of course, you can do it for longer if you can or if you want, but basically take a break every 20 minutes. Look at something off in the distance. Don't take a break from your computer and then go look at your phone, right? So give your eyes a break from the screen and protect them from these dangerous rays and forms of light. Sleep is really important. Hydration is important. All the things that you normally think of for good health. Exercise is really important. We want to encourage circulation. Blood pressure is something that a lot of people don't think of when it comes to eyes. We've talked about it several times here already, but you have to optimize your blood pressure. High blood pressure is one of the most damaging things that can impact your body. It negatively impacts all the small blood vessels in your body, to the kidneys, to the brain, to the eyes. One of the most common causes of high blood pressure is elevated insulin and insulin resistance. But, there's other things that can do it as well. Stress, poor diet, obviously, and other things. So optimize your blood pressure, get good sleep, optimize your blood sugar and metabolic health and insulin levels, protect your eyes from damaging rays. Get your eyes checked, too. I know that you're talking to a lot of ophthalmologists, optometrists, and they're going to say this ad nauseum, but you've got to get your eyes checked, especially if you have any type of metabolic health problem like insulin resistance, prediabetes, type 2 diabetes, is go in at least once a year. Just have your eyes checked to make sure that they aren't developing issues. And then the last thing is there's nutrients that can be really helpful. So there's a lot of foods, there's a lot of supplemental nutrients which can be helpful. Leafy greens are wonderful for the eyes. Bright, colorful fruits, you mentioned berries, really good for the eyes. Eggs, egg yolks in particular, are high in lutein and zeaxanthin, which are carotenoids, which are really helpful for the eyes. I'm sure I'm not the first one to mention that, but these are important nutrients. All the main vitamins, vitamin A, C, E, are really good for the eyes. Astaxanthin is really good for the eyes as well, which is something that can be found in like krill and certain seafood. And then omega-3 fats, really important for the eyes. So getting a high concentrated DHA fish oil or eating fatty fish, I think is really important for eye health as well.
I think for a moment, I want to talk about somebody who I'm thinking of that was close to me and my family. We're talking about blood sugar today and eating well. And it's kind of hard if your blood sugar is all over the place. You get these wild cravings. You tend to crave some of these foods that everybody out there knows you shouldn't be eating. Chlorella, chewing on these green tablets, it was a game changer in terms of balancing this person's blood sugar. And I know it does help. So it's important for people to realize that when your blood sugar is high or up and down, and you're on this roller coaster ride, eat healthier, right? Obviously, the health experts will say that, but I want people to really appreciate how you got to do anything you can to keep yourself more stable. Find those sweet things that don't spike you as much. Another thing I wanted to mention besides the chlorella, the berries, everybody hears that they're good, but I've been getting into more lately goji berries.
Yeah.
They're not like grapes, you buy at the supermarket, these seedless grapes that are like, they're all sugar, right? It's like sugar balls that you're chewing and it's just super sweet. These are not like that, but I tell you, now that I've been doing it on a regular basis, a nice handful of those every day, really good for the eyes. I let them sort of get moist and softer in my mouth and let them sit in there. It really kind of takes that edge away when you feel like something sweet, but it's very mild and it's super delicious and really healthy for you, right?
Absolutely. Another one is Indian gooseberries. Those also have compounds in them that are actually really good for blood sugar and compounds that can help the eyes. So that's another one I'll throw in there. I love the suggestion for chlorella. I love those little chlorella tablets. They're kind of have like a nutty flavor to them, and you can chew on them. They're actually pretty good source of protein. I mean, there's not a lot of protein per, but if you eat like 8 or 10 of them or something like that, you're getting vitamin B. You're getting a lot of vitamin B. You're getting that chlorophyll. You're getting some good quality plant protein. And they do seem to be good for the blood sugar. And I think you're right. There's something about chewing on those that seems to diminish sugar and carbohydrate cravings as well. So that's something that is good. I actually do those oftentimes if I'm fasting. I'll do like a 24 or 48 hour fast several times a month. And I like that for myself, not for everyone, but it does work well for me. And I don't get into whether it's a pure fast or not. So I don't mind chewing on some chlorella tablets, probably not a pure fast by doing that, but you're not getting a ton of energy from those, like a ton of caloric energy from those. It does give your body some poor nutrition, and it seems to keep like cravings at bay, which is nice.
As we close out, last couple minutes or so, I'll give the floor to you. Are there any other tips you would like to talk to people about in terms of they're really concerned about their blood sugar, their eye health? How would you like to end this?
We oftentimes think about relationships in our lives to our partner maybe to our boss if we have a boss, or our clients if we have clients, or our children, and our friends, our family members. Those are all important relationships, but we don't necessarily think about our relationship to our food. And I think it's such a critical relationship in our lives. It's something that we really need to be aware of, be mindful of, and work on improving. A lot of people have cravings, and this gets in the way of progress. Like, people can listen to what we're saying and say, yeah, that makes sense. I've tried to do that before, and it just doesn't seem to work for me. I can't stick with that. And they don't find that same enjoyment that you described out of eating these foods that are good for them. They want to go eat some pizza or have some ice cream or something like that. And those foods, while probably okay from time to time, are not contributing to our metabolic health in a good way, especially if you already have poor metabolic health. We need to be careful. And it's not this idea of I can or I can't, as much as it is, what do I want to put into my body, and what is that relationship with the food I'm eating? And I think when we crave foods like that, sweets, desserts, packaged foods, snacks, it tells us something about our relationship to food. We're looking for something from our food other than the quality nourishment it can provide. We're looking for entertainment. We're looking for comfort. We're looking for stimulation. We're looking for distraction. We're looking for something from our food other than what it's there for. And so I just want to leave with this. Inspect that. Investigate that. Be mindful of that, of those feelings you have around your food. And it doesn't make you a bad person. It just means that, we just want to shine some light on it and say, what can I do to improve that relationship the same way I'm going to improve other relationships in my life? What can I do to establish a healthier relationship with the food I'm eating? And then that'll give back to you when it comes to energy levels, metabolic health, prevention of disease long term. And, that's a whole nother talk about how we can fix our relationship with food. But I just want to say, be mindful of it, be aware of it, don't sweep it under the rug, because for a lot of people, that really is the key factor.
I've known you for many years, and I can tell you, you've really dialed in your education on blood sugar issues and helping people in the public. I really appreciate all the information that you put out. And I know if people have heard this well, they should probably listen to this presentation one more time to get 100% more out of it. I know for sure you're helping a lot of people with this info, and thank you very much for your time. I really appreciate you.
Thank you, Jonathan. I appreciate you having me.
That was truly an empowering message from Dr. Mowll, and a reminder that protecting your vision starts with understanding your whole body health. Be sure to watch the next video you see on this page to hear from Dr. Glenn Swartout and Dr. Robert T. Maria. These two experts are bringing a fresh perspective on how to restore vision and address light sensitivity in ways most people have never heard of. I created the Eye Health DocuClass to give you the best natural and holistic tools for preventing, even reversing serious eye problems without the fear, drugs, or risky procedures offered by conventional eye doctors. If you'd like to own the entire Eye Health DocuClass, including some amazing bonuses, simply click the link on this page and choose the package that's best for you. Talk to you soon. Take care.